Well, it's Thursday, and therefore In Focus Health correspondent Linord Moudou now joins us, and I believe, Linord, today you're going to give us some new information on blindness.
And that's right, Vincent. Get this, over 300 million people worldwide are visually impaired, and 45 million of them are blind. The World Health Organization says 87% of the world's visually impaired live in developing countries, and cataract remains the leading cause of blindness globally. Other major causes include diabetes, trachoma, and diseases in children. Experts say age-related impairment is increasing, but the good news is the number of people blinded by infectious disease is being greatly reduced. Thomas Alieu was not so lucky. At the age of 5, he lost his sight to illness. Mr. Alieu is now the founder of the Educational Center for the Blind and Visually Impaired in Sierra Leone.
I became blind at the tender age of 5 after an attack of measles, and that eventually made me to lose my sight. My parents were very poor. So when I had these measles, they never took me to the hospital, but they used native herbs, and eventually all these native herbs helped to destroy my eyes. It was very difficult because, I had the opportunity to see the beautiful world. Then later on, I couldn't have the opportunity again to see and play with my friends. Generally, we have a very negative socio-cultural beliefs. Blind people are expected to be limited to the four corners of their home. And because of this, blind people who should be partners in nation building are forced to be dropped out in our society, and they take to the street as beggars.
The WHO says approximately 75% of blindness worldwide could be prevented or cured. An organization based here in the United States is working to save sight and eliminate avoidable blindness around the world. Joining us in the studio is Dr. Hunter Cherwek, Medical Director of Orbis International. Dr. Hunter, welcome to the program.
Thank you very much. It's wonderful to be here.
It's great to have you. Your organization has been working around the world fighting blindness, and in particular in Africa. Tell us about what type of diseases you've come across.
Sure. Just like Thomas spoke on the piece, a lot of infectious causes are still a problem in Africa, specifically river blindness, trachoma, as well as he mentioned rubella and measles. All of these are reducing, but that's because of the great work of organizations like Orbis International that are focused on saving sight worldwide.
And one of your specific project is the Flying Eye Hospital.
Yes.
The plane is traveling around the world doing surgery, treating people. Tell us about that.
Yes, it is a DC-10 plane that's maintained by FedEx. They're a great corporate sponsor. This plane is not only able to give the highest level of eye care possible no matter where we are in the world, but it's also designed to teach so that we're building capacity and leaving an academic legacy after the plane takes off.
So tell us exactly what is being done on the ground once the plane lands in a country. For example, you were in Uganda not long ago.
Absolutely. When we land in a country, all we ask is that the doctors partner with us to help deliver the eye care program, as well as to participate in the training program. We not only train doctors, but we train nurses as well as engineers. So it really is a service delivery as well as a training program that tries to build capacity in whichever country where the plane may be found.
It's very important that you mention capacity building, because a lot of time when some NGOs go in a country, when they leave, there's a problem with the follow-up. Now, tell us about the type of training that you administer to these doctors.
Absolutely. Well, first of all, we do basic science training through lectures and workshops. But I think the real important thing, which the plane allows, is direct hands-on training. 2 teams working together in partnership, exchanging skills and demonstrating best practices for the patients on board the plane, as well as at the partner hospital. When the plane lands, about half the team works on the Flying Eye Hospital. The other half works at the partner hospital at the local hospital. We're all about showing how, not showing off at Orbis. And that's really what makes us such a great organization, is our partnership model and working through a partnership and capacity building effort.
Now, in the plane, what what type of treatment or surgery is taking place?
We could do the exact same surgery on the plane as you can here in Washington, D.C. We have lasers. We have, now again, we're specifically focused on saving sight. So all we do is eye surgery. But every single surgery that you could do here in Washington, D.C., we can do on the Orbis aircraft. And again, the plane was designed to teach. So we also have teaching facilities. We have an audiovisual studio, and we have monitors so that all the classroom, all the nurses can be engaged with the surgery on board the plane.
Now, really quickly, what will be the next country, or what will you be doing next?
Yes, next year is a very exciting schedule. We'll be in Syria, we'll be in Nigeria, we'll be in Laos, then we'll go to Nepal, Mongolia, and then South America, specifically Peru.
Great, Dr. Hunter. Thank you so much for coming.
Thank you so much for allowing us to be here.
And it's time for a short break.